NTV.
Well, like I hinted earlier, the Saving Lives Marathon is scheduled for 1st March 2020. The marathon is aimed at raising funds to strengthen emergency care services to save lives in the greater Kampala area. The background, well, Uganda has continued to register high rates of accidents in Uganda in the region. Well, between 2006 and 2016, you had road crash fatalities increased by 20.59%. That is from 2,597 all the way to 3,503, with the accident severity index of 24 people killed and 100 road crashes. Well, 10 people die daily in road traffic accidents, which is the biggest rate in East Africa. So this makes the issue of emergency services very critical, and in that regard I have Tadeo Atuhura, a communications officer and partnership manager right there at Mildmay Hospital, and also Dr. Violet Nabate. She's a pediatrician at Mildmay Hospital. Many thanks for joining me. Very good morning.
Good morning.
So let's first talk about this marathon, the Saving Lives Marathon on March 1st. What should we look out for? Why are you mounting such a marathon? What is the urgency?
Thank you. Good morning, viewers. On 1st March we are running, and we are running to save lives of premature babies. Last year we ran, and we thank the public who supported Mildmay Uganda to be able to do a marathon and save lives as a result of accidents. We were able to buy an ambulance, which is currently at the hospital and serving so many people. And we thank you, the public, for being able to support us. Now, this year, we're really out to save lives of the premature babies. Doctor will be able to give you the background about the premature babies. And on 1st March, we all go to Kololo, and we're able to really participate in this. For every contribution that you give, our tickets are for 20,000, and we've got quite a number of sponsorships that have been able to come on board and were able to support us, that we're able to put up a neonatal clinic, a neonatal unit that is able to support, save lives of these premature babies. It's one of the areas that I think has been ignored for some time, but from the hospital background, based on our experience, for over 20 years, we've been able to realize that it's one of the key areas that we need to be able to strengthen. And you'll agree with me at one point, like Doctor will give you the statistics, that we have so many of the babies that are born prematurely. But the question is, how are they managed? How are their lives saved? Most times, they are actually too expensive to maintain a premature in terms of care. So this time around, we are looking at that person who cannot be able to support that kind of cost. Where can they be able to go? We need to have, as Mildmay, a place where we're able to support lives of the babies that have been born prematurely. So this is the whole purpose of the this marathon.
And of course it comes at a pivotal time, this marathon, because it comes at a time when Ugandans are having a conversation on the kind of services they are receiving in both the public and the private health care facilities. Mrs. Violet, what are the figures? Where were we back in the day, like a decade ago, and where are we now, and what needs to be changed?
Okay, thank you very much. But right now, as we look at emergency situations, now our main focus is being the issue that we have prematurity. Many babies are being born premature, but the global burden right now is 15 million babies are born premature. That is annually. That's on the global scene. But what we ride on as Uganda is we note that when we break it down, 1 in every 10 deliveries is premature. So that gives us a percentage of about 10%. So for every 10 mothers that deliver, 1 of them delivers a premature baby. And our biggest concern is we have spent so much on everything else except looked at this premature baby. And these are babies that are costly, that need a lot to ensure that they actually reach full-time survival. Now, looking at the costs of different places, because most of our settings do not have this service. And that is why Mildmay is coming up and saying, okay, we have a maternity wing, we are able to deliver mothers. But what if these mothers are delivering premature babies? What support can we give? So the reason we are extending this service to ensure that when this mother delivers, we don't have to refer her, we can keep her in what we call a neonatal intensive care unit, but also to support all the other people around Entebbe Road, around Kampala Greater Metropolitan, to have another hospital that's an addition to the service that is offered. These babies are costly in terms of money. that's finances, because maintaining them will require breathing support, it will require feeding support, it will require warming support, and all this costs a lot of money, but also it drains the mother, it drains the parent, it drains families and clans, because they all have to put in a lot. Some of these babies may spend a month or two in the neonatal intensive care unit, and this is all resources that actually at the end of the day impact on the government of Uganda. So we really want to put in a lot to be able to save these babies, because if we don't have this service, then the facilities that we are offering are substandard, and of course this ends up resulting in deaths, because complications of prematurity are one of the leading causes of deaths in children under 5 years.
Is this problem being experienced in other hospitals in Uganda as well, both public and private?
Yes, it is being experienced, and on the side of Ministry of Health, there's what they call a newborn steering committee that's going around and trying to do a needs assessment in every regional referral hospital to ensure that they are able to have a particular kind of service, because you realize that if you go to Kawempe Regional Referral Hospital, most of the babies are being referred there, but they're overwhelmed by the numbers. So it's all about strengthening the different regions to be able to handle these babies, because the problem is actually there.
Mr. Tadeo, how will the Saving Lives Marathon on March 1st arrest the situation after the whole exercise has ended?
Now, when the whole exercise ends, a doctor said it's very expensive, first of all, to be able to maintain a premature. Now, our target, we're looking at about 420 million.
From the proceeds of the marathon.
From proceeds of the marathon. Now, that may look to be quite really a big uphill task to be able to solve. But we know a contribution of 20,000 from an individual is able to walk towards that journey and achieve it finally. And we've walked this journey. We just bought an ambulance last year from the same marathon. Now, this time around, if you contribute 20,000 and you're able to have all of us contribute towards this, we know that we shall be able to put up the unit, some of the equipment be bought and then put at the hospital. And then lives of these babies will be saved. And that's why on this point, really, we appreciate those that have really come up so much. NTV is so great to you guys for having really supported this cause. And highlighting it as well. But we also have other partners that have come on board to be able to work with us this journey. And the key to this, we have the UMI alumni group, we have the KCB, Stanbic Bank, we have the Standard Chartered Bank, we have UAP, we have CBS Capital, Okra, Britam, Ministry of Defense and Veteran Affairs, Uganda Police, Ministry of Health. So there is a team really that has come up to say, yes, I think we need to save. TMT. So we're so grateful that at the end of the day, we're walking a journey of saving the lives of these babies. So on 1st March, we're going to be doing the running. But we don't also stop the commitments from people beyond 1st March. You could be able to walk into Maldme and be able to say, look, I'm able to contribute this towards the marathon. You could be able to give a commitment and say, look, I would like to support this, maybe have this machine. Can it be able to contribute towards saving the lives that you're talking about? So it's beyond just the marathon, but the marathon is the starting point. It's the spark that we want to have, and then we discuss about this, but also contribute towards something. And one of the things that I've learned is that you can't continue discussing about an issue, but so long as you don't put your foot on the ground
I see your
to
point.
do something, that little contribution will save that life.
So
of
we
that
are talking
baby.
about sacrifices.
Yes, sacrifices.
And before we go into the whole issue of the sacrifices, another group that is actually doing something to arrest the situation is the Ministry of Health. They've really tried so hard to bankroll the various public and private health facilities to actually extend services to the people. But then nothing has changed. There's still poor quality or poor services being extended to the people. Why do you think that is the case, despite the support?
Yeah, despite the support, there are those initiatives. You need to have this expectation the government is going to provide. But you see, the whole delivery of a premature is a whole process that starts with the man, the woman being together and then having to know which kind of family they want. Because at the end of the day, like Doctor will explain, some of these causes really can be arrested. They can be dealt with at even household level. Now, if you talk about a household that is empowered, a household that has a steady income, a household that prioritizes health, they're able to know, yes, this is the kind of baby we want at this point in time. But if you're going to wait at the end of the day to say, okay, government has done this. The question I would have is, what has been your role? Because
I like that.
yes, because we, even as we set up this unit, we are not saying that we are advertising that people should have premature babies. No, it's just like when we got the ambulance, we didn't say, okay, go reckless, drive,
We shall be able
because
to take
after
care
all
of
the
you.
ambulance is there. No, but there is that personal initiative and personal responsibility that we need to take to be able to have a healthy baby. But when that does not happen, that's when we have services of a premature baby being put in place. So government has done its role. The sensitization has gone on. In the facilities, you really see the healthcare providers wanting to save their life.
Ms. Violet, before we head into the personal sacrifices the doctors are making to arrest the situation despite the ugly situation, let's talk about the fact that the patients do not know their rights. We've gotten information from some hospitals where pregnant women go to a hospital and they're not worked on or dealt with just because they do not have the money to pay first. Remember, there's that policy, if you do not pay first, we do not work on you. But according to the patient's charter, it's very, very clear. You, as a medical practitioner, you're supposed to work on a patient whether or not they've paid any single coin. But it seems like the patients do not know that there is a law that actually is in favor of them. Please help us explain how this has exacerbated the whole problem of poor quality of services.
Okay, yeah. Firstly, we know from the communities where every patient comes from, there are discussions at household level. And from my personal experience, I'll be in places and then I'm like, I'm referring you to Mulago. And the patient says, I cannot go to Mulago because I have to pay. But I've worked in Mulago. I have studied in Mulago. I know what exactly is there and I know what service is offered. Some of these things that we say are a problem are created by actually us, the people at the household level, because we have so much propaganda. There are so many stories we say. We convinced ourselves that no doctor is going to touch you when you don't pay any money. But come on, if you have the money, and you throw it at the health worker, what do you expect them to do at that point? Because we have levels of health workers. Even cleaners are called health workers because they just have the title Omusawo, provided you are around the health service. So at the end of the day, by the time you reach me, the pediatrician, you have paid a lot of money to a cleaner, to an attendant in the office or whatever. So it's all about the patient knowing what is the right channel that I'm supposed to follow. If they know the channel to follow, then most of these things will not be happening.
So there's less information penetration.
Exactly.
So
So
the
we
patients
just need
do
to go
not-
out
they
there.
don't even know their rights or what they're supposed to do.
Exactly. So we just have to call upon whoever is concerned about this. But even when the patients come to us, we always do a health education. We sensitize them on what exactly they are supposed to have. Because it's not enough to come to a health facility and then say, oh, you have not taken care of me because I don't have any money. Why do you presuppose that I need money from you? It's all about the service. And also the willingness or the empowerment to have a health-seeking behavior. When we look at prematurity, one of the things that can actually prevent it is antenatal attendance. And we have mothers who don't attend antenatal for various reasons. Sometimes I don't have the transport to get there. They are thinking of the health worker attitude. The midwife is going to shout at me, the doctor will yell at me. And then she goes through the pregnancy and only appears at 7 months when she's going to deliver a premature baby. But most of these conditions like high blood pressure, diabetes mellitus, sometimes HIV, or even sexually transmitted infections will result in premature delivery. But if you demystified all this and came to the health facility early, then we are going to arrest this and we shall have a baby born after 9 months. So most of these things are actually preventable. It's all about our mindset and how much information we get
But
at the grassroots
would you
level.
agree that at the moment we are losing babies because some doctors are adamant to work on patients before they pay money? Do you agree that it's happening in some circles?
That's because I have read about it, actually. I don't have the critical evidence, but I've heard stories. I've read about it. And I definitely cannot say, yes, this is happening, because at Maidme it's not. But then in the other places, because of the documentation that is seen in the newspapers, probably it's right. Yeah.
Because there was an example of one of our colleagues who underwent some kind of delivery. They took long to work on her, and at the end of the day, they referred her to a different health center. By the time she got there, it was too late. They were already asking for money. She didn't have the money, so she lost the baby. And she did not know her rights, that she can still demand, even though the baby is dead, she can take this hospital hospital to courts of law, sue that they did not work on her in that regard. It seems like there's a whole lot of information that needs to be disseminated to the population to understand their rights in that regard. But then, on the other hand, let's talk about the doctors who are making the sacrifices. What is the weight of sacrifices that doctors have to make in this very, very poor healthcare system?
Now, just about the point that you raised in terms of the whole issue of rights. And yes, we have rights as patients, but also there is the obligation that we need to take. Because I have also followed up some cases where you realize that actually the mother arrived late just because they didn't want to die or have problems at the household level. Now, you're living really limited time for you to be able to save a life. If you're going to save a life, there's going to be a little bit of getting to know I'm supposed to be doing this, and the other. Now, to the other teams, I must tell you that health workers doing a great job. Because even in a perfect health system, you're going to have the individuals that are able to run the show at the end of the day. One critical thing that we need to have is, first of all, have confidence in our own healthcare system. And the healthcare providers, just one of the components within the healthcare system. Now, when you realize it even from the rights perspective, a patient has the biggest percentage of responsibility. Because I've also seen situations whereby patients are given prescriptions in terms of their medication, but they don't take it. Now, by the time they come back to the health worker, you realize that actually they have not actually improved. Now, we also still have, it all goes back to the issues of sensitization. So, but also part of what is about this discussion with the marathon, it's not all about being able to raise money. It's also about raising awareness about the premature babies. Because we've seen situations whereby somebody feels that, no, I think delivering a premature baby has issues related to witchcraft, has, you know, that kind of thing. And you know, in our system, when you deliver without, when you deliver normally, they say, I think this person is strong. When a mother delivers a premature, there is a whole system that looks at them as, I think they couldn't afford and kind of thing, they are not that strong. So that alone also stigmatizes within society. Now, this whole the marathon as well is to look at sensitizing people about it. If you've got a premature, first of all, how did it happen? Why? Because when you get one premature, it doesn't mean that you stop delivering. You're going to have more babies. How do you prevent it? First of all, is it preventable? Yes, it is preventable. How do you manage it? Is the next course of action, the following 1, 2, 3. Like she's talked about antenatal attendance. If you're going mandatory at least like 4 times, have you attended them? Have you been well cared for? Now, have you delivered at the health system or through the hospital that's supposed to be delivering you? Or you have remained at home and you expect to be able to have a healthy baby. So it's a whole lot of sensitizing people and get to know about this. And we believe that that is going to save these babies at the end of the day.
Dr. Violet, what is the weight of the sacrifice being made by the doctors actually in this very, very poor healthcare system? Because we've seen in so many occasions doctors going out of their way. Like for yourselves, you've mounted a marathon. No one had to ask you. That is a sacrifice. And in other hospitals, they do not have the gloves, they do not have the resources, so they are dealing with a lot of mental health issues, but they still stick around and they do their jobs, even when they are being berated by the same patients who call them rude or the other way around. Now, help us understand the magnitude of that sacrifice that doctors are making in this very, very ailing healthcare system.
Maybe I'll just take it back to if you have seen people who choose to go on strike because of circumstances. When you look at the medical field, most of their strikes have actually not taken place, or they haven't really happened. But when I look at medical school back then, at graduation time, we have what we call the Hippocratic Oath. Now, when you take that oath, it has specifics that actually would bar you from doing certain things, and you stick in there. And I think this is what practically drives the sacrifice issue, because we always remember the Hippocratic Oath, and you really want to help, because at the end of the day, what pays me off is the patient getting better. And that is what I always look at. If you come to me, you're very sick, what I am looking at is reviving you, giving life back to you. And that is the payment that I get. So however bad the circumstances are, the doctors have tried to really stick in there. We are looking at figures, we are looking at the magnitude and saying, okay, there are so many deaths under 5, but what is killing these babies? So then you go back, characterize them and say, okay, it's diarrheal diseases, it's pneumonias, it's prematurity. So what can I hold? What can I do?
Stepping out of your way.
Exactly.
Your comfort
So
zone.
if I choose prematurity today, like Mild May is doing, then I am saying, okay, when I save premature babies, then these babies are not going to die. What can I do? That's when I have to get out there and say, okay, guys, let's run and raise some money. Maybe we'll be able to buy an incubator, we'll be able to buy a warmer, we'll be able to buy a resuscitator to assist these babies along the way. So at the end of the day, it's the end product of patient care, of patient health that I am looking at, and that is what drives the sacrifice amidst all the challenges
So
the healthcare system.
So we need more patriotic doctors in
Exactly.
the healthcare system
Yes.
who are
Exactly.
willing to go to leave their comfort zones and do more for the community.
Yeah.
I was reading a story in the United States that broke on Tuesday. There was this lady that was being diagnosed that she was a drunkard. Everywhere she went, even the police would get her and say, lady, your liver, you need a liver transplant. But then some doctor, Dr. Tamama, went out of his way and did some more extra tests. Imagine what he found out. That she had a lot of sugar in her body, and it was interacting with the yeast in her bladder,
Yeah.
creating alcohol in the body. So whenever they checked, they would find that, hey, you have a DUI, you are above the percentage. But this
Exactly.
woman was stigmatized since she was a child, that she was a drunkard, but she never was. But it took the initiative of one single doctor and a sacrifice to change her life and maybe help other people who might be grappling with the same.
Exactly.
That was called the gastrointestinal tract something, yes, and the gut fermentation syndrome. And in a nutshell, Mr. Tadeo, as we wrap up, tell us what should the people expect on this marathon March 1st as we wrap up.
March 1st, we're
final
expecting all of you to be able to turn up and support this cause. The tickets can be accessed at Mild May Hospital, at also Lueza petrol station, just next to us at FuelX. We can also be able to access them through the Eco Pharmacy outlets. Eco Pharmacy offered us to be able to sell these tickets at 20,000. You can go to Loom Street, you can go to next to Butter Shop, and then be able to buy yourself a ticket. Krish Mall in Bugolobi, you can be able to go to Ntinda, Capital Shoppers. All these have these kits. Now what you're expecting is that at 6 a.m. we arrive at Kololo. We are going to run through the following categories. We have a 14-kilometer race, we have a 10-kilometer race, we have a 7, we have a 5, and then a 2-kilometer race. So you come, we set off at exactly 6:30. We shall be able to set off and then run. Now, there are those who are saying, no, but I'm not to be able to run, but I want to give a contribution towards saving lives of the premature babies. We have the numbers 0759 21 2005. The other one is 0773 698058.
Amazing. And Dr. Violet, in your parting words, any golden nuggets for the pregnant mothers out there or the would-be mothers?
Thank you very much. My message to the pregnant mothers is they need to eat healthy, they need to attend antenatal care and make sure they follow the schedule as it is given, because in this it helps the medical workers pick out several things that are treatable that might result in having premature babies. But also, I want to emphasize to pregnant women to stop buying drugs for themselves, because some of the drugs are not compatible with a pregnant woman and they might end up resulting in premature delivery. But also, all hope is not lost when this premature is born. We want to ensure that we are able to take care of them and support the whole family as a system.
Wise words from Dr. Violet Nabate, a pediatrician, and also Dr. Tadeo Atuhura. He's a communication and partnership manager right there at Mild May Hospital. They've been helping us understand what we need to do best to ensure that we end up or eliminate prematurity in this era. And as it is, they will be launching a marathon, Saving Lives Marathon, on March 1st to get more money to actually arrest the same situation. Premature babies. You're in the know right about now. We're going to take a very short break. Keep it NTV. A lot more is coming your way.